more than half of this cannula inserted never really got used, which is such a waste of, causing unnecessary anxiety and pain, suffering to patient, waste of clinician's time and a lot of resources, and increase the cost to hospital. My name is Grace Hu. I'm a nurse practitioner working in QEII Hospital Emergency Department and Royal Brisbane Women's Hospital and Emergency Trauma Centre. I'm also a clinician researcher. I have been a emergency nurse for 16 years and a nurse practitioner for 10 years. When I start research, there's not many nursing clinicians in Queensland conduct research. I really just fell into it naturally because I was looking for answers to solve my clinical issues, which is eventually led to a PhD focused on clinician well-being. Soon after I started off my PhD and COVID-19 hit. So as you could imagine at that time, everything's very stressful, and because my research topic and also a frontline clinicians in busy emergency department. So I was naturally fell into that leadership role to become a researcher. So my research helped to inform the policies and also some practice during that challenge time. And after I finished my PhD, I stopped working full-time as clinician, split my time into still work as clinician, but also another half of time become a researcher. So I started to look at the research around how to improve patient care, emergency care, and also using different research design and methodologies, trying to get the most out of it. Although I haven't really been into research for a long time, but I've been absolutely very lucky. Got more than 20 grants in the last 6 years and 40 plus publications, and have a lot of collaboration with amazing researchers around me, and in this multi-site random control trial and clinical study, which is make meaningful difference to patient. So I guess what is really drove me in at that point in time, still kept me here, is really how do we make the best care to our patient. I think clinicians are in a very specific, really special roles because we know what's going on, in the clinical setting. We're also using our research methodology to design the best care and study for our patients. So I'm really encouraging clinicians to get into the field of research so we can make a difference together for patient care. Since I finished my PhD, I'm starting to move into studies try to improve patient care. One of the special interests is on vascular access device. So especially the little peripheral intravenous catheters, we call it cannulas. So people in hospital, 70% of patients come to hospital will need a cannula for intravenous fluid, medication, and other different investigation as well. 50% of these cannulas inserted by clinician in emergency department. So although it's a very common skill by ED clinician, however, we don't really do really well based on my research, and a lot of other study as well proved there's a lot of area need to be improved. For example, more than half of this cannula inserted never really got used, which is such a waste of, causing unnecessary anxiety and pain, suffering to patient, waste of clinician's time and a lot of resources, and increase the cost to hospital. So my research really just focused on improving all the cares around this area and thinking about how to improve the insertion in a better way so patient can suffering less, and how do we involve patient in our study, in our care as well, so we can make a decision together to improve patient care. And one of my recent study is about and improving, decision making, and sort of for our patient care. So as I said, I was really lucky and received multiple grants from Emergency Medicine Foundation in the last few years. And this this project really just helped me to improve care from that perspective. So for example, the most recent one we got is I use machine learning to help to create clinical decision-making tools to help our clinician to make better, accurate decisions to decide to insert this cannula or not. So by the end of the day, if it works, hopefully that will save a lot of unnecessary insertions and reduce our patient suffering and improve the experiences, and also reduce all the unnecessary cost and complication to patient care. I'm a member of AVATAR. So AVATAR is an international research collaboration body based in Brisbane, and we have a great range of researchers like clinicians, nurses, medical staff. We focus on vascular access device. So I actually grew up with people in AVATAR group and became a researcher. And apart from that, my research knowledge, I collaborate with a wide range of people like frontline clinicians, and also include our patient into our study. We co-design, studies in a way to make sure it's meaningful to our patient care and make sure their voice got heard as well. I was lucky, got more than 20 grants in the last 6 years, and include several of them from Emergency Medicine Foundation, some from the healthcare services like Metro Source Hospital, and as well as a one category 1 national grant, like MRFF grant, as an implementation science lead. So I was very lucky to get supported by a range of people to help me to conduct the study. Without their help, there's no way I can achieve what I achieve, and especially appreciate the help from Emergency Medicine Foundation because they are the first everyone and trust me and believe me and invest in me. So that helped me to open up my research career and become who I am today. As a clinician, I look at patients every day in busy emergency department. For example, when patients come to ED, they will need a peripheral intravenous cannula. So we insert these cannulas into patient arm and help, obviously, to deliver medication, fluid, and drugs. Although it's very common procedures, however, I observed so many practice is probably not done in the best way, and which is cause patient suffering and causing unnecessary pain, anxiety, and same as leading to a lot of waste as well of clinicians' time and also hospital organizations. So I think by observing all this area, and which are not perfect at this time, and I feel like we can do better. So with my skill and my special interest in this area, so I design my studies to help our clinician to perform this particular procedure better in a way, so patient can have less complications and hopefully they can discharge from the hospital quicker, and that help us organization save a lot of monies. Being a clinician researcher is challenging because clinically we've been asked function differently in the research world. It's almost like you got 2 jobs and you have 2 different set of KPI to achieve. So as a clinician, you need to stay as many patients as you want to, give them best care as you could in that specific time. But when you go into the research world, it's kind of something more ongoing in your mind, and although you not really get paid for the hours, but you still have to think about what's my next project, how the things go, and trying to be almost like running your own business and to make sure everything works. And there's a lot of things unexpected will happen no matter what project you're running and how well you organized. So it is challenging in a way, but also I think that from a probably positive perspective, because I feel like as a clinician, I know what's going on in the real world and know what will work, what will not work, by even, have a look at that particular issue and the things to do. So helping to prioritize my limited time and energy on the thing I think worth investigate on, rather than just thought about an idea, don't really know whether that gonna happen on gonna work or not work in reality. So I think having this 2 lens just helped me to be more accurately selecting the thing I want to do, and then also have a good range assess of my patients and clinicians who are around us. I could even have a corridor chat with my colleagues, and they will tell us that's a bad idea, so I should just leave it, or it's a good idea, we should sort of continue spend time, money on that. In regarding of balancing the life and work, I think that's a challenge for everyone. And burnout is a very common issue for clinicians and also as an academic and researcher as well. So it's important to keep yourself well, sort of always asking yourself, why I'm doing this, what I want out of it. Apart from keep working and working hard, working long hours, it is important to also draw a line in the sand, sort of knowing, I need to spend time with my family and I need to do different things. Outside of my work, I have my children and my husband. So what kept me really well is like I have several hobbies. For example, I like indoor plant. I really pick up that hobby during the COVID-19 pandemic while we get locked down and can't really go outside to do anything. Nowadays, I not only looking after a lot of plant at home when I'm getting stressed. It's really good sort of touch the soil, get things done, give them some water. Sort of it also gave me a time to settle down and recalibrate of my brain. And I also give plant to my colleagues and my friends as well as a little wellness gift, and just keep things going in a positive way. Always look up to sun. And I also like hiking and Pilates, all this sort of exercise. I feel like as clinicians, we just got to be physically and well, and keep some exercise is one of the really important elements in our life to keep our well.